Come in.
I'm washing my hands. Hello, Mr. Hoffman. My name's Nancy. I'm a nurse. How are you?
Doing well, thank you.
I'm going to be doing an assessment of your hair, skin, and nails today.
Okay.
I'm going to start out by asking you 2 questions. Any history of skin cancer?
None.
Do you lay out in the sun, tan,
No.
go to a tanning booth?
No.
Okay. All right. Well, that's good. When you do go out in the sun, do you wear sunscreen?
I don't.
Oh, okay. All right. So it is important for preventing skin cancer to wear sunscreen when you're out in the sun. All right, so I'm just going to go ahead and move along with looking at your skin. So I'm going to have you put your legs up, and if you want to lay back, if it's more comfortable, that'd be fine. Okay, so I'm looking at your skin color overall, looking at your face and your chest, and what I'm looking for is, do I see anything abnormal like pallor or paleness, cyanosis, that would be blue, erythema, that's red, or jaundice, which would be yellow. And then I'm inspecting the skin, and I'm also touching the skin of the upper extremities and the lower extremities, checking for temperature. And I see that your skin is warm and dry. And I note that your skin is smooth and thin. That is normal. Skin is thin. The only places where we have thick skin is on the palms of our hands and the soles of our feet. I'm also going to, right here, check for turgor and mobility. When I pinch the skin up, it should move easily. That would be normal mobility, and it should go right back to normal. That would be right back to its normal spot. That would be a normal turgor. So mobility and turgor. Mobility, how easy does it move? Turgor, how easily does it go back into place? Okay, and then I'm also, as I'm looking at the skin, I notice that you have lots of moles on your chest, anteriorly, kind of all different sizes and different shapes, but mostly all the same color, light brown to a darker brown. I don't see anything that is larger than 6 millimeters, so I don't see anything of concern. And then on the legs, I don't see any moles. I do see this one spot right here where you have a little lesion that is healing. You mentioned that was from a bike accident. It looks like there's another small one right here. I do see that the skin looks normal here. I don't see any lesions or anything abnormal all the way down to your feet. And then if you could sit up for a second, let me look at your skin in the back. So again, I'm going to have you stand up and turn around for a second. There we go. So looking at the back, I see a lot of moles on the back, and I see a lot of macula. Macula are freckles. Okay, so there's lots of freckles right up here on the upper shoulders, and I would just document that as numerous light brown macula on the shoulders. And then I would also document numerous small, less than 6 millimeter papules over the anterior and posterior chest. I would document about this mole separately. It is less than 6 millimeters. It's oval in shape, which is symmetrical. It's dark brown and it's raised. So this might be something, Mr. Hoffman, this is right on your back, so it's probably hard to see. So probably if you can have a family member look at that for you every month and just keep an eye on that and make sure that it's not changing. Are you aware of this mole right here?
Yes, I am.
Okay, and has it changed at all over the years?
It does not seem to have.
Okay, all right, so that would be the only one that I would be at all concerned about. Okay, you can have a seat again. And then we're gonna go on to look at your hair. Okay, so I see your hair is a mix of brown and gray. It's smooth. Your hair distribution is symmetrical. You have some very typical male pattern baldness, but that's expected. And I'm looking, what I do is I part the hair, okay, and really look in there for any infestations or any lesions or anything in the hair, which I do not see. Everything looks completely normal, nice and smooth, and clean hair. And then we're gonna go on to looking at the nails. So I'm gonna look at the nails on your fingers. To start out with, what I'm looking for is that the nail bed should be pink and the nails shape is round. Some people have flat nails this way, flat. Some people have a little bit more rounded. Some of your nails are a little rounded and some are flat. And when I press on the nail bed, it should feel firm. It should not feel spongy. And I also check for the profile sign, which should be 160 degrees or less, which I see that yours is 160 degrees, which is normal. And I'm going to do the same on this hand as well. I'm looking at the nail beds. They are pink. Nails are rounded. Your profile sign is less than 160 degrees. And then I'm going to do the same on your feet. I'm going to lift your feet up here again. All right, so I'm looking at your toenails. The beds of the toenails are pink. Your toenails are flat. We usually just check the profile sign on the fingernails. So I see one nail here is a little bit yellow and thicker. That can happen with aging, that the nails sometimes get thicker, or it can also happen with a fungal infection of the nail. So, Mr. Hoffman, before we finish with assessment of hair, skin, and nails, I want to just give you a little tool that you can use for assessing your skin for any risk of skin cancer. So we use an acronym, it's called ABCD, to help you remember what to look for. So when you're looking at that mole on your back or any other moles that you may see, the first letter is A. A stands for asymmetry. So if it looks asymmetrical, meaning that it's irregular and the two sides do not match, that would be a concern. Okay, B is for borders. If the borders are not smooth and regular, they're irregular borders, that would be a concern. C is for color. When color, what we're looking for is variable color within the same mole. Like if you see a mole that's got brown and black and blue and red on the same mole, that would be a concern. And then the last thing is D, or diameter. So if it's more than 1/2 of an inch or about the size of an eraser of a pencil, that would be a concern. So that's how it helps you to remember how to look at your moles and when to contact your physician for follow-up. So use A, B, C, D. Understand?
I do, thank you.
Any questions?
None at this time.
Okay, thank you. That concludes our assessment of the hair, skin, and nails.